Joe, thank you so much for joining me, and I'm very excited to hear all about the recent work and research you've been doing with men who have Peyronie's disease after prostate cancer treatment. Could you firstly please tell me the story of how you got interested in this particular area?
It's a really interesting story, and thanks for having me, Victoria. So basically, I spend a lot of my day working with men as a physiotherapist in a men's health specialty clinic, working with lots of urologists, and I get to learn a lot from my patients. But this learning curve was something I didn't quite anticipate. What basically happened was one of my prostatectomy patients, who was quite young, he was just 45 years of age, had had a robotic procedure 12 months earlier and had pre-opted him and looked after him for a couple of months, and he'd had a wonderful recovery with his continence, and his erectile function was emerging. On this particular day, he knocked at my clinic door and he was very distressed and asked if I could see him, and I walked him in when I could. And basically he proceeded to show me a photo of his very curved penis, which he'd said had been there for about 3 or 4 months. And he was very bothered, quite concerned, in fact, that his prostate cancer had returned, because he could feel a hard lump in his penis. He also showed me this photo, which I still have today. And it's basically an indication here of the way his curvature had presented. He'd had some pain, and I reassured him that he probably had something called Peyronie's disease, and that it wasn't like to be his cancer, that we should check with his urologist, and then I would work on it. I'm happy to say that we were able to work on providing him with some therapeutic ultrasound that's an everyday physiotherapy tool. We were able to clear up his problem to the point where within just a month or so, the curve had regressed quite a bit. And then not long after that, we added a vacuum pump to help straighten out the last area. And today is 3 years since then, and he's still in good functioning order. So that's how I got involved in Peyronie's. I was already doing a PhD, and this kind of just took me to a different direction completely, but a really fascinating and hopefully helpful topic.
Joe, that's a wonderful story. Thank you so much for sharing that and for including learning curve as a pun, whether you intended to or not. I always appreciate it.
At that moment, I didn't mean to.
Fantastic. Well, thank you so much, Joe. And
No
look forward to
problem.
asking more questions in the future.
Okay, thank you.